We're now joined by Brian McGovern, Chief Executive Officer of the North Jersey Community Research Initiative. Good to see you, Brian.
Good to see you. Good morning.
Good morning. We're taping in the morning. It'll be seen later in the day in a lot of cases. Hey, let's talk about where we are. First of all, talk about your organization as we put the website up, and then I'm going to get into a whole range of issues that are so important to all of us, not just certain populations. Go ahead.
NJCRI was born as a HIV/AIDS organization, '88, but today it's really blossomed into really a community service health center, social service center that serves the needs of the people depending on what's coming up at the moment. A great example of that is how we've handled COVID, monkeypox, some of the infections that are causing our community some harm and trying to get us back on track.
Talk to us, Brian, about where we are with HIV rates in New Jersey and the nation.
Sure. I don't actually have the numbers in front of me right now, but HIV has really had an upsurge after COVID and during COVID. A lot of services were down. People weren't coming out of the houses, but people were still connecting at high risk. So our numbers have more than doubled the last 2 years of new infection rates. And so that has been kind of an explosion in New Jersey. The state's very well aware of that, and we are all working on bringing those numbers back down. One of the neat things that's going on that's on a state and a national level, which is HIV prevention and care. So they're really combining the two. And with this strong testing model and health screening model in the community, what we're doing is we're helping people either get into preventive care, what is known as kind of PrEP, as a lot of people might know, and I can tell you more about that, or care, HIV care. And many people today, HIV positive, are living very healthy and are undetectable and therefore untransmittable of HIV disease. So this is really helping. Sorry.
I'm sorry for interrupting. Go ahead. Finish your point.
No, so this is really helping reduce HIV infection in our community and really bringing down. And the goal is to really eradicate HIV as this epidemic.
I want to talk about monkeypox in just a moment, but tell us about the Total Health Awareness Program. What is it as we keep the website up?
So that program is a program that actually does a lot of work in the community. It works with primarily an MSM population, or men who have sex with men, or high-risk HIV people. What we do is we go out in the community, or we serve people literally in the clinic or on a mobile unit in the community, and we will do health care screening for HIV, other STIs, Hep C.
STIs, clarify that these are sexually
transmitted diseases. And so these are usually higher rates than HIV. So people kind of ignore them, and they can be treated with medication. So they're not a long-term illness, but they are something that has raised those rates, and we're trying to get those down. So with all that, we can do screening, and we can get people on preventive medication or HIV treatment literally in the street, where we'll bring out medical doctors and so on that will help us.
So let me ask you something, Brian, and I asked you a little bit about this last time you were with us, but I want to follow up on this. As we talk about monkeypox, as we talk about the population most affected by monkeypox, to what degree do you believe that for some watching right now, and to many across the state, this region, this nation, and that's not really my issue, that doesn't affect me because it does disproportionately impact men having sex with men, to what degree do you believe that is connected to a long-standing, not just the stigma, but prejudice and just frankly, a lack of concern about the community we're talking about, the people, the human beings we're talking about, discrimination?
Absolutely.
I know it's a loaded question, but go ahead.
No, it's a great point. I think HIV and the word stigma are so connected. I think is what we're concerned about is the same thing with monkeypox. It is true, monkeypox has a higher rate of infection right now in the world of gay men. And I will say that we've had a great population coming in of gay men to get vaccinated. And so that's great to see. And we're also using that tool to reach out to some of these people that might not be coming in every day for an HIV test or an STI, find out about their other parts of their health. And so we use that as a tool to also give them those other opportunities, which is awesome. The other, though, the stigma part of that, where we have to be careful, is the general population. Depending on your work, maybe you're a massage therapist, you're touching other bodies all day. You're living in a commune situation where you could be sharing other clothing or bedding or something like that, but you're not having sex with someone. You still could get monkeypox. So we have to think outside the box of how this could affect, so we don't put a stigma on someone who says, I'm not in that box. I'm not gay, I'm not LGBT, so I'm not at risk. Many of our healthcare workers understand that and will navigate themselves if they're at high risk, and will get that. But we want the general population to understand that just as much.
Again, the website continues to be up. There are so many people directly affected, and others who are friends, family members directly affected. But in many ways, as Brian just described, this is all of our issue. And if it's not, if we don't see it that way, I'll get off my soapbox. That's part of the problem. What is the Rainbow program?
The Rainbow program is a new program that we started this year, and it's about interpartner violence for LGBT. So why we call it interpartner instead of domestic violence or violence between husband and wife is, one, in the LGBT community, people may not be married. Two, it might be a transgender person being violence towards them in the community. It might be an intimate relationship that's not maybe a long-term one. So it really broadens that definition of the relationship violence. And so it's one of its first and unique in our state. And
what does it do, Brian? I'm sorry. What exactly does it do?
I'm sorry. So what it does is anywhere from a hotline where people can call in.
P.S. Let's put the hotline. I'm sorry for doing this while we're doing the show. Put the hotline up and say you call the hotline. What happens?
When you call the hotline, you will get live people that will walk you through whatever service you might need in that area, from medical attention, from an emergency room, to respite care to get away from that environment, to find a place of shelter, and or mental health or support that way. And lastly, last placement or court. If you need someone to be an advocate for you in court, we can set that up as well. So basically full service, what you might need in that area. 30
seconds left. This work is incredibly important now more than ever because
it's not, we're getting to a place where HIV/AIDS is coming to a more manageable place with this really 4-pillar we're looking at of like healthcare prevention, looking at all areas of what someone might need. And as a result of that, I see this as something that finally we could look at getting a better handle on, getting more under control.
I want to thank Brian McGovern, Chief Executive Officer of the North Jersey Community Research Initiative. Brian, thank you for joining us. I promise you'll continue to be a part of our programming to keep us up to date on issues that matter to a very large segment of our community. Thanks so much, Brian.
Thank you.
You got it. I'm Steve Adubato. That's Brian McGovern. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Rutgers University, Newark, PSC&G, the Port Authority of New York and New Jersey, TD Bank, the Fidelco Group, Holy Name, the New Jersey Economic Development Authority, and by IBEW Local 102. Promotional support provided by the New Jersey Business and Industry Association and by AM 970 The Answer.
Hello, I'm Dr. Luke Ironman, a family medicine specialist at Holy Name. When was your last visit to your primary care doctor? Throughout the pandemic, many patients have put off their annual physicals and screenings, but preventative healthcare is critical for early detection of illnesses and to avoid future health problems. Your doctor can also help you develop a wellness plan to achieve your personal health goals. Your health can't wait. Be proactive and talk to your primary care doctor today about scheduling your annual physical.